All right, fair warning, we're doing some major girl talk we were just
Major girl
mentioning
talk.
here. But as we all know, periods can vary from woman to woman, but there is a standard of what is considered normal. Dr. Jennifer Gilby, an OBGYN physician from Women's Care Florida, is here to explain what normal is. Good morning.
Morning.
We've just been chatting away up here, which I think this is so interesting and so important that we're talking about this, because as we were talking about before we started, I think us as women, we just assume what's going on with us is normal, and we're delaying going in and talking to somebody about
Exactly.
it because we just think, well, this is how it's been, or this is what it is now, and I just need to live with it and tolerate it.
Yeah, and I think that's the good message that we want to get out to women out there, is that yes, you know, having a period or having normal bleeding that's anywhere from 21 to 35 days apart, that's normal. Anything outside of those, any sooner, any longer in between, should be evaluated. You know, even if you've had really heavy bleeding your entire life, it's not normal necessarily, you know, and there are things we can do that are minimally invasive, may not even involve hormones, you know, because I think women, A, don't want surgery, B, don't want to take hormones. They are afraid there's nothing else that can be done. So there's just really a lot that can be offered. And so I encourage women to talk to their physician, to seek out a good OBGYN, to get advice, you know, and to be sure and bring it up at your yearly visit. You know, is this normal? And what I'm having very normal?
Well, and I think with certain life changes, obviously I'm just back from having a child, and I think, you know, as you age and as different life events happen, I mean, it's hard to know what normal is when your life is constantly changing.
Yes, and it does change. I mean, in that time period after children, that's a very common time frame where things really are different. And, you know, bleeding might be heavier, it might be longer, it might be more frequent, it might be less frequent, you know. And I think those are times to also address with the physician, you know, hey, is what I'm experiencing normal? You know, thyroid can cause abnormal bleeding.
I was just going to ask, what are some different things? Obviously, hormones, I feel, are just, I mean, that's like the biggest thing that comes to mind. But what are some other factors that could be affecting?
Well, there can be anatomic changes within the uterus. I mean, there's fibroids, polyps, those can cause abnormal bleeding. There can be hormonal fluctuations that are imbalanced, and then there can be infectious reasons behind it. And then there's, you know, the big C word, cancer, you know, pre-cancer, cancerous changes can also cause those. So, you know, there's a multitude of things that, you know, need to be investigated and not just taken at face value. Oh, this is just the way it is, and this is, I have to suffer.
And treatment as well. We were talking about many years ago, I think a lot of women were getting hysterectomies. I mean, that felt like the common practice of, oh, there's something wrong, let's just take it all out.
Exactly.
You say there's so many different options now.
That's rarely where we go now. You know, it's, I mean, we do hysterectomies, but they're really for more extreme reasons. You know, we have endometrial ablation procedures, which, you know, actually are minimally invasive, done in the office with light sedation. You're home within an hour and a half, and it can make your periods go away totally. So if you're having really heavy abnormal bleeding, you're not going through menopause, it's not affecting your hormones, you know. So it's a really nice way, if we've gone through all the other things to get there, there's a minimally invasive surgical approach to it too.
How often should you be seeing your OBGYN or your doctor? I mean, is it a yearly?
Yes, so that's a great question. You know, the new recommendations for pap smears have gone to where pap smears are only needed every 3 to 5 years, depending on whether the HPV screening has been done at your pap smear. But that is not the only thing that is done at that exam. I mean, we do, you know,
it's checking in, finding
breast
out
exam,
what's going
pelvic
on.
exam, you know, everything else still needs to be done yearly. So it's really important for women, and even after a hysterectomy, for women to come see their OBGYN, discuss their hormonal issues, discuss everything that's going on, and let them help you.
All right, sounds good. That's a perfect way to end the segment. Thank you so much for coming in.
Thank you for having me. I really enjoyed being here.
Obviously, if you have questions, you know, feel free, give them a call. There's the website there. Make the appointment, and don't be afraid to ask what is normal, what should